I already have a mask and face shield on. Patient already have a mask on. Hello, this is Amy. My name is Nee, and I will be your nurse today till 11. And I would like to do a tracheostomy care for you and some little suctioning. Is that okay? Oh, I understand that you can't talk, so how about you give me a thumbs up and when you want to say yes, and thumbs down when you want to say no. And during procedure, if it's get too uncomfortable or pain or anything, just tap on the bed and let me know. I will bring down a paper and a pen for you to write down your concern. Okay? Okay, that's good. Okay, Mrs. Amy, I'm just going to check your name and date of birth here. Amy Harris, 7/5/1971. Is that correct? Okay, that's good. Mrs. Amy, do you have any allergies? I don't see any allergies down here. No, not even to chlorhexidine? No? Okay. So I'm gonna do a set of vital signs. I'm gonna check your temperature, your heart rate, your respiration rate, your blood pressure, your oxygen set, and then your pain. Do you have any pain? No? Okay. And your oxygen set now is 93%, which is a little low. We'll make sure to give you some oxygen later on, okay? Okay. And I can see that your respiration rate is 20 times per minute, which is normal. See that you have an equal rise and fall of the chest. You're breathing normally. Do you have any shortness of breath or difficulty breathing right now? No? Okay, so now I go ahead and listening to your lungs, and I already cleaned my stethoscope. I'll go under your gown, okay? Take a deep breath in and out for me. Good. Even out, even out, even out, even out. Okay. I can hear some gurgling sound in your lungs, so I think we should do a suction cap, a set of suction for you, okay? Okay. Then, have you had this procedure done before, Mrs. Amy? Yes. And were you able to tolerate any procedure like this at all? Yes. Okay. And do you want me to explain one more time? Yes. So what I'm gonna do is I'm gonna put some oxygen for you, and then I will suction. After suctioning, I will change the inner cannula to a new one, and change the dressing, and then change the stabilizer. Clean around, make sure that it's clean for you, okay? Okay, that's good. And do you have any question or concern for me before I start? No? Okay, that's good. I will wash my hands, put on my gloves. So for my bedside equipment check, I have a oxygen attached to the ammo bag here, and I also have suction catheter working at 120mm mercury attaching to this the suction canister, and also I have two trachs, one current side, one smaller, and one inner cannula. Okay, so that's the bedside equipment. So now I will go ahead, clean my table for 30 seconds, and then I will let it dry for 2 minutes or completely. 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay? And then I will just let it dry for 2 minutes. Washing my hands again. So it's already dry. I'll go ahead and put on my supplies on the table. I have a sterile gloves, extra pair, and I have a sterile disposable container, and then a sterile suction catheter. And I have tracheostomy care tray, and in the cannula. Okay, and I also have stabilizer and normal saline. Okay, so put this normal saline here. Okay, so wash my hands again, put on my gloves. Mrs. Amy, I will close the curtain for you, okay? We want to keep this procedure privacy, okay? So I will close the curtain, provide privacy for patient. I will raise the head of the bed to a semi-phallic position, which is a good position for this procedure. Is it good for you? Comfortable? Yes? Okay. Do you have do you want me to explain procedure one more time? No? Okay. Then I will put the towel on your chest, okay? Take off the gloves. I'm washing my hands again. Put on your gloves. And I'm gonna go ahead and change your suction catheter because I see that it's there, but I don't know how long it has been there. So I go ahead and change it to a new one. And I'm just gonna pretend to do it because mine already attached to the tube. So this tube, okay. So it's attached, and this one is the one now. Put it away, put this back. Okay, so I turned on at 120 mm mercury and it's working continuously. And also the oxygen is working at 100% oxygen. Okay, so that's good. Wipe my hands. Now I will open my trach kit. Okay. Now I can take out the gloves. Okay, and now I will take my inner cannula and drop into the box. Make sure I don't touch the box. Okay, that's good. I will drop this. And now just clean up, wash my hands, put on your gloves. And then I'm going to take out the sterile disposable container. And make sure not to touch the inside. Okay, put that down. Just only touching the outside of the box. And then I can put some sterile saline halfway through. And then I'm going to do the other side. Put some sterile saline in here as well. Okay. And then I will put this on the side for now. Okay, Mrs. Amy, I'm just gonna verify the suctioning, okay? Okay, is suctioning good? Okay, so now I will use some oxygen through the end move back, and I will wait 6 seconds in between breaths, and I will give you 2 breaths, okay? So this is my non-dominant hand, this is my dominant hand. Take it out, non-dominant hand, hold it. Use my dominant hand to pump the oxygen through the end move back. 1, 2, 3, 4, 5, 6. 2, 1, 2, 3, 4, 5, 6. Okay, that's good. How are you feeling, Mrs. Amy? You doing good? Okay, so now I will start suctioning, and then make sure that the suctioning process should take less than 10 seconds. And I will go in until the patient starts coughing or until I feel resistant. Okay, so I just press on this and take it out slowly. And then I will just put some in here, make sure that it's ready for the next use. Okay, so I will put your oxygen source back, and then I'll put this away to the table. The other side. Okay, so Mrs. Amy, I can see that your oxygen sat pop up pretty quick there. It's now 95%. Okay, and because it's 95%, so we don't need more hyperoxygenation for you. Okay. But for the suctioning, do you want me to suction you a few more times? No? So the patient declines suctioning, more suctionings, but if the patient still wants to, then I would wait 30 seconds between each suctioning, okay? Okay. And now I will take my gloves off. Wash my hands. How do you feel, Mrs. Amy? You feeling okay? Okay, just tap on the back to let me know anytime, okay? Okay, so I'm going to put on my new gloves, my sterile gloves. Okay, it's on. I will go ahead and take this, the cup, the glove. Okay, so that's good. We'll discard this above my waist. Okay, and it's in a proper receptacle. So now I can take my sterile tape out. Make sure I don't touch her towel. Okay, just like that. And now I can put the Q-tip into the sealing box. And I can take this split dressing, put on the side. And I can take 2 of the gauze, put in the sealing part. Okay. So now it's good. Okay, this is Amy. I'm gonna go ahead and change your inner cannula, okay? So this is gonna be my non-sterile hand. This is gonna be my sterile hand. I'm gonna take it out, hold it, take it out, put it in a appropriate receptacle. Now I'm taking a new inner cannula and only touching the top. Put in, make sure I don't touch my non-sterile hand. Properly clipped it. Perfect. Okay, and how do you feel, Mrs. Amy? You feel good? No pain? No shortness of breath or anything? Good? Okay, that's good. I can see that your oxygen set is still 95%, okay? That's good. Taking out the dressing, still stabilizing the faceplate. Put it away, okay? And now I will take the Q-tip, but before that, I'm just gonna see your side assessment. I can see that side looks good, no sign of infection or skin breakdown, no redness, no swelling, clean, dry, intact, and your stabilizer looks a little dirty, but it's not too tight or too loose on your neck, and I can see that your own inner cannula were properly clipped. Okay, so now I'll go ahead and go under the faceplate. One swipe, only one swipe. Okay, you don't want to clean the dirty one to the clean one. Okay, one swipe the bottom. Okay, now I will take the sterile saline gauze to clean the faceplate, clean the top and down the side of the gauze. And then I will clean the bottom another time. Okay, and put it in appropriate receptacle. And now I will use clean gauze to pat on the faceplate. Make sure it's dry and clean. Good. Okay, this is Amy. I'm gonna put a new dressing on for you, okay? And I'm gonna put it under your stabilizer, and I'm still stabilizing your faceplate the whole time. Okay, so I'm stabilizing. Okay, and then I'm gonna put your oxygen back. How do you feel, Mrs. Amy? You feeling okay? Good? No pain? No shortness of breath? You feeling better? Okay, that's good. And now I can see that your oxygen set is still 95%, okay? Okay. So for the stabilizer change, I would always need 2 people in real life situation. But in my situation, I don't have anyone, so I will go ahead and do it by myself. But again, we always need 2 people, one person to hold the faceplate and the other person to change stabilizer, okay? I'm just washing my hands and put on new gloves. Okay. And Mrs. Amy, I'm going to change the stabilizer. Make sure it's clean for you, okay? Be a new one. Okay, so I will open my stabilizer. And then I'll take out the oxygen source. Then I will try to stabilize the faceplate as much as I can. I scoop the old one under the neck of Mrs. Amy. Now I will one, a new one. Okay, and now I will go under your neck, okay, Mrs. Amy, and I'm assessing the side right now. It looks good, no sign of infection or breakdown. Okay, Miss Amy, can you just move your head up a little bit? I just want to see here. Yeah, no sign of infection or breakdown, clean, dry, intact, no soreness or swelling. Okay, now I will hold this side for the faceplate and open the stabilizer. And then I will take the old stabilizer out the way. And then I'll put this in appropriate receptacle. And I will put in my new stabilizer. Okay, and I make sure that it fits properly. I can put 2 fingers inside. 2 fingers on both sides. Okay, that's good. It's not too tight or too loose. I'm gonna put your oxygen back. How do you feel, Mrs. Amy? How you feel about procedure? Do you feel better? Yes? Do you feel any pain now? No? Do you feel any shortness of breath? No? Okay, that's good. I'm going to discard these in the appropriate receptacle. Take off my gloves. Wash my hands. Amazing. So, I need to make sure that the emergency equipment is still on your bedside. So I can see that you have an amber bag. I've got your oxygen 100% working, and a ready to use suction catheter connected to the canister, and it's working at 120 millimeter mercury. And you also have 2 trachs, one smaller side, one current side, and one inner cannula. Okay, and I'm gonna go do a set of vital signs, and I don't see that you have any difficulty breathing, don't you? No difficulty breathing? You breathing normal? Okay, that's good. And you said that you don't have shortness of breath or no pain? No? Okay. So now I will go ahead and listen to your lung. I will go under your towel, okay? 2, 3, 4, 5, 6. Okay. I will just keep your towels there in case of future sputum, okay, or splashes. And so your lung cells are much clear. It's much better than before, and your oxygen set is now 96%. Okay, good improvement after that procedure. And were you able to tolerate procedure? Yes, you were. And you have any question or concern for me before I leave? No? Okay, so here's your call line. Just call me anytime you need anything, okay? And now I will lower the bed to lower the lowest position. And I will go ahead and leave the room, wash my hands. And for my post documentation, I will document the day, the time, the patient were able to tolerate procedure, the peristomal site assessment, the site looks good, no sign of infection or skin breakdown, and there was a minimum white thin secretion or sputum in the suction catheter. And also I will also record my vital sign, oxygen set, and respiratory assessment before, during, and after the procedure. Okay, so I already washed my hand. Okay, thank you, Mrs. Amy. I will see you in a little bit, okay? Okay, thank you. Bye.